Good evening. It's a pleasure to be here with you and certainly our respected and esteemed panel. We are tonight going to talk about recovery and relapse and overdose and the importance of relationships and effective responses as best we can. And certainly this is to spawn interest and next steps for you. So we are very, very happy that you're with us tonight. We realize how important it is to work effectively together, the importance of relationships and working together, recognizing that the challenges that we have can't be solved during this incredibly challenging and vulnerable time by one person or by one entity. But it really does take all of us. The social isolation, the fear, the uncertainty, the at-risk populations, the health disparities that existed prior to the pandemic, the lack of awareness that really helps recovery and helps people who are struggling every day, day to day. And we know that much of that has led to overdose deaths that have hit a record high last year. You may know that there were over 93,000 overdose deaths last year. That calculates to almost 250 deaths a day. We know that the drugs that are on the street today are laced with fentanyl, more so than they ever have been. About 60% of the street drugs are laced with some degree of fentanyl. Families, schools and communities are really struggling with what to do, how to respond to their loved ones, how do they care for their loved ones. It's needless to say, these are big challenges and they have led to the vulnerable times that we're in. We are here to focus on the hope, the help, the optimism, the awareness, and that recovery actually does happen as well. You probably know that there are over 23 million people who are in recovery in the United States on any given day. But the fact is that only 1 out of every 10 people who needs help gets help. So that means that 9 out of 10 people who need help are somehow not getting it. And we know that there are many pathways to recovery. We know that there are many pathways for a person to get well. So we hope to move to some of that discussion tonight. First, I will ask Dr. Cheryl Mejta to introduce herself, and then we'll go to Dr. Fatoki, and then Dr. Joseph Day, and then Joseph Martin. So we'll do those introductions, and then we'll get into our questions. Dr. Mejta?
Thank you, Professor Palanca. I'm Dr. Cheryl Mejta. I'm the chair of the Department of Addiction Studies and Behavioral Health. And within our department, we offer a graduate degree in addiction studies, as well as an undergraduate degree in community health. We are a longstanding program who have helped people and prepared people to provide effective counseling to people with substance use issues. I want to welcome you to the Governor State University Facebook Live event. We have a great expert panel that will help us discuss these issues and come up with some strategies to help people who struggle with substance use disorders. Professor Peter Palanca is going to serve as our moderator, and he's a leader in the substance abuse field for many, many years. He's an advocate for treatment. He's a longtime educator at Governor State University, as well as having served as clinical directors and administrative directors at many prominent substance use treatment organizations. So thank you for moderating, Professor Palanca.
Thank you very much, Dr. Mejta. And yes, we are sort of an example of people who are committed, very spoken about, and and you'll hear more about each of our backgrounds, which I think reflects the level of commitment that exists around the table. So Dr. Fatoki, if you wouldn't mind introducing yourself, please.
Good evening, and thank you. My name is Yemi Fatoki. I'm a physician who is board certified in family medicine and addiction medicine. I'm also a graduate of the Governor State University Masters in Addiction Studies program. I decided to go to the program so I could learn more about addiction to help me better treat the patients that I was seeing at the different jails and in my office where I worked. So in 2007, I started my first opioid treatment program, and I'm just happy to be in the field of addiction medicine. It's a field that has a lot of need for qualified professionals and physicians who are committed to help. The one thing that I've learned is to view addiction as a chronic disease and treat it as such. And one of the most gratifying things is to see how people recover and how people do well. I'm grateful for the support that I've had from my former professors at Governor State and the collaboration that I still maintain with the university to try to be as helpful as I can and also to continue to work in the field of addiction medicine.
Well, thank you very much, Dr. Fatoki. Dr. Day?
Hi, I'm Joseph Day. I'm the director of the Community Health Program, which is in the Department of Addiction Studies. My background is in public health, in particular community health. And what interests me about addiction is that we need to, of course, addiction is an individual problem, but it has community ramifications. And we really have to think about the person who's addicted within the community and how that affects the community and all the individuals within the community. I am just so pleased to be here, and I hope we all can have a good discussion and everybody learn something.
Thank you, Dr. Day, very much. And I want to just, before we go to you, Joe, it has been such an incredible honor and pleasure to work with both Dr. Fatoki and Dr. Day, who have worked closely with the Addiction Studies Department at Governor State. They have been advisors, consultants, and very directly have affected much of what we do. So gratitude to both of you. Joe Martin, so good that you are with us, Joe.
I appreciate it. I'm Joe Martin. I'm a peer support specialist at the Veterans Assistance Commission here in Joliet. I'm also a student of the game as far as Governor State. I'm a recovery coach. I have 25 years of active addiction in my life. I also have 30 years of recovery. So I'm kind of bringing my experience, my strengths, and my hopes to the table so that those that are in active addiction really would know that recovery does work. And that's pretty much where I'm at with it right now.
Joe, thank you very much. And for those of you that have not heard about recovery coaching, it is an incredibly, incredibly important aspect of the care that people receive, particularly on the front and back ends of recovery services. So, and Joe has really been one of the leaders carrying the banner for that. So we have those before us that have been leaders in our field. So having said that, and we're remembering that we want to create as much as we can a foundation for hope and help and optimism and recovery. So as we think about those things and we move into our questions, our first question is, what's been the impact of substance use and relapse during the pandemic? It's been a challenging time, a vulnerable time, but from your perspective, and that's a question, that's an open question to any of you, what's been the impact on substance use and relapse during the pandemic from your perspective? You've heard the data, you know the numbers, you're familiar with what's the media says, but in the work that you do.
I'll start off.
Well, Peter, I think
Go ahead.
go ahead.
Go ahead, Joe.
I was
Okay.
just going to say, I think in light of COVID, one of the things that's happened is that drug overdoses and relapses have not gotten the same kind of media attention as in the past. And we do know that people have struggled with isolation and have not been able to utilize the support systems they've built up the years and led to overdoses. Actually, than COVID.
Thank you, Dr. Mehta. Your reception is not as good as any of us would like it to be. Joe, I know you were going to address that question, and I'm sure Dr. Mehta will make every attempt to get back with us. She's obviously having technical difficulties.
Yeah, I was just going to add to what she was saying. I think the isolation it played a really big part in the addiction process. I've learned that left to our own devices, addict alone is in bad company. He really needs the camaraderie of the of other the therapeutic community. You know what I'm saying, to express himself and where he's at, his ups and downs, his highs, his lows, and things that he's going through. I think his therapeutic is a big part of it. It's one of the reasons I became a recovery coach, to be a liaison in between the addict or the person that's using and maybe their family or their sponsor or whatever it is that I can do to help them better understand that the disease of addiction is apparent, and then the end result would always be jails, institution, or death. We have to address that in that order in order for them to get to be better at understanding what life on life terms is, and we just have to face life as it comes, and there's no way around it.
Excellent, Joe. Thank you. Thank you.
One of the things that I've noticed, if I can jump in, is that Dr. Mehta and Joe mentioned, the isolation has been quite severe on a lot of the patients. But also as a physician, we've had telemedicine as an option to be able to see the patients, but it really doesn't equate to that one-on-one physical contact that I'm used to having with my patients. They come in, they look forward to being seen. We also are able to do like random urine drug testing, or even just to sit down and talk to people and socialize with them. That part is missing. So it's difficult to be able to monitor the patients. Some patients feel more comfortable talking to you in person. And many of the patients are technologically challenged. We also have issues with the internet. Sometimes the reception is poor, trying to connect, and it's a little more difficult and challenging, but we're making it work. And I mean, I'm hoping that we may have even had more overdoses if we did not have the telemedicine and the technology to help see some of the patients.
So the point is that telemedicine has been helpful and added value with some patients, but there are some major factors that don't allow it to be as helpful as it might be.
That's correct.
I'd like to add a little bit to that in the sense that these are fearful times, and the pandemic has increased our sense of fear and anxiety. And we know that when people are afraid, they want comfort, they need something to make them feel normal. And some people are using drugs at an alarming rate to help change their feelings. And a lot of this is directly related to the fear and anxiety of possibly catching COVID or passing COVID or living in a world of uncertainty.
One of the statements that you made there, Joe, was they look for something to help them to feel normal. And these are times that it's difficult to feel normal, right? There's a lot that's around us that's not, quote, normal, the way that any of us understood it. So that even makes it more challenging and unsettling for people with addiction, doesn't it?
Yeah.
Yeah. Let's move. So thank you for those comments. We're, the thing that we're talking about, and we've mentioned recovery and we've mentioned treatment and intervention, but we know that the role of stigma that is played in our field is dramatic. So as you think about stigma and you think about its impact on individuals getting help, stigma's impact on family members getting help, what's your perspective on the impact of stigma and what we might do to eradicate some of it? Because it is an issue.
Well, I think it discourages people from seeking treatment, which is very unfortunate. One of the things that I struggle with is why we have to look at addiction as something different from other chronic illnesses. And I remember there was a time when there was a lot of stigma associated with obesity. Like now, it's becoming a little more accepted, than it used to be. And I think addiction is still lagging behind. I've worked in jails and seen patients coming where they would rather suffer with withdrawal symptoms rather than tell the medical staff that they have a problem with addiction, with opiates or alcohol or whatever, just so that we could treat them appropriately. The way people are viewed, especially when you go to a clinic that it's a treatment clinic. We don't treat our patients the way we treat most people. We look down on them, which is, again, unfortunate. And those are things that discourage people from seeking help and also lead to people overdosing, because rather than seek the help, they keep struggling with that addiction and trying to find a way to overcome it themselves, which many times we know is not possible without getting some kind of assistance from a professional.
Yeah, that issue of not measuring up is a big deal with people with substance use disorders, isn't it? Not feeling like they are quite who they were supposed to be or meant to be. Dr. Day or Joe?
I think Dr. Pataki said it very well. We live in a culture where the individual, not the community, is king. And until we change that and consider the individual within the community as being the most important thing, well, I don't think it's going to change. I mean, community is treatment as far as I'm concerned. And if everybody's on board with the ideal that this person suffers from a chronic relapsing disease, then we can help. But once we point fingers and consider this person a pariah, an outcast, someone who's not fit to be associated with, isolation and then more use is what will come of it.
Joe, I know you have some thoughts about that.
Yeah, absolutely. I was correct me if I'm wrong. We're talking about the stigma. I guess I think the premise has always been once an addict, always an addict. But we have proven that to be not true, because recovery is possible. And as you stated earlier, there's millions of recovering addicts or recovering people all over the world. So, and some of us look at the stigma as individuals being that quote unquote junkie with the overcoat, eating out of garbage cans and things to that effect, but that's not necessarily true. Addiction affects anybody and everybody. I have been to meeting where there's doctors and nurses and lawyers sitting at the table openly admitting that they have drug problems. So the stigma of saying once an addict is always an addict is it's no longer a true statement because of the science, the medicine that we bring to the table, the therapeutic value of one helping another, recovery coaches, the schooling that GSU bring to the table, the enlightenment that people have about recovery. It works. So all I'm saying is the stigma is no longer true. We do have recovery people that can attest to that the process does work.
So if I can add something to Professor Palanca,
Please.
You know, in minority and you know, I'll say the African community, because I'm an African. You know, you do see the stigma. It's even more pronounced, and we tend to deny and minimize those problems. We don't admit to accept that we have drug problems or alcohol problems, and we just tend to hide that. You know, so I'm starting to see that, and that I'm glad we have this forum so we could bring that up, that there is help, instead of us hiding it and trying to behave like it doesn't exist at all, which is what a lot of foreigners tend to do, because they are too ashamed to admit that someone in their family has a problem with addiction.
No, the point that shame and guilt are underpinnings of continued use and are underpinnings of keeping people stuck is really a most excellent point. And Dr. Fatoki, I think you make it very, very well in terms of those that come from communities that haven't been accepted to the extent that other communities might have been. And when they develop a substance use disorder, when they develop active addiction, they are often treated differently by their community. So absolutely the truth. And I wanted to continue to remind us there are those 23 million people that are living a life of recovery every day, a day at a time. So as we move forward, what can individuals and communities do now to respond? How can we work better together? As you think about communities, as you think about the things that you've seen, maybe some of the things that have worked really, really well. What can communities, what can we all do to work better together?
I think that in these COVID times, it eliminated a lot of the recovery modalities that was taking place throughout the community. I know here in the area where I live, there's a shortage of meeting spaces where recovering people will come together and unite. And like I said, the therapeutic value of one addict helping another was without parallel. It has the meeting attendance has dropped, and I know it's COVID times, and I surely don't want us to move too fast too soon. But the Zoom online process stepped in, and the technology took place, and we lost a lot of recovery addicts, but we also gained a lot of recovery people who wanted to understand how the Zoom process worked and things like that. But I think what's more important is, as soon as we could see just a little daylight, and I could see it in my area, the meeting spaces are picking up, and people are coming into the rooms and sharing their experiences and their strengths and their hope, and giving each other the I guess the enlightenment that, that recovery is still possible even in these trying times. We are trying to do the best that we very, very can in order to help each other stay united in this process so that they can, live life on its own terms. It's like I said earlier, an addict alone is in bad company, really bad company.
Thank you, Joe. That's very powerful. Dr. Fatoki, we haven't talked about the role of medication. We haven't talked about the importance and the value of medication. And I don't want to leave tonight's panel we've got just, I think, a few minutes left with mentioning the importance of the role of medication.
Yes, medication. There are medications that are effective in the treatment of opioid addiction and alcohol use disorder. And I think we need to, again, look at those illnesses like we look at any other chronic illness. I believe strongly in the use of medication, especially since it's evidence-based, it's proven to be as effective as when you use it to treat any other chronic illness. There's still a lot of stigma there, even amongst physicians. There are some physicians who feel that the patients only need to be on the medication for a few weeks or a few months. But the way I see it, if I have someone that I'm treating for hypertension or diabetes, I don't tell them I'm only going to give you medication for 3 months. I'm going to give them medication as long as it takes and also continue to educate them. But there's plenty of, at least there are 3 classes of medications that are effective out there. There's buprenorphine for opioids, there's methadone, and there's also Vivitrol or naltrexone. For alcohol, there are medications that are also effective. How long the patient needs medication, it depends because one size does not fit all. And also what medication will work for one patient, it also depends. We have to work with the patient to figure out what's going to work for them therapeutically and also with counseling. One thing that I would like to mention is like the state of Illinois has at least taken the initiative to try to encourage the treatment of addiction in jails. One of the jails that I go to, we're allowed to use all modalities of medications that will work for opioid treatment. So we start patients in treatment right from the time they come in and also make sure that they have somewhere to go when they leave the jail. And I see that has been a plus in encouraging people to seek treatment and also reducing the stigma. Because now, instead of sending people to prison, we're at least recognizing that this is a disease that can be treated effectively with medication and counseling.
Excellent. Thank you very much, Dr. Fatoki. Dr. Day, just a comment about communities and strengthening communities and maybe something that you've seen that really has brought strength to the community where recovery has been possible. Thoughts that you have in that regard?
Well, I think that it's a process. It's about developing trust. It's a slow process. And therein lies the problem because we want immediate returns on the work we do. If we help somebody, we feel that should be enough and they won't offend or hurt or do all the bad things that they might have done. But it doesn't work like that. Addiction in particular doesn't work like that. So we have to trust in the humans that we are around in our community and feel that we are investing. It's about investing in people like we're doing now. This talk is about investing in all the people who have turned in because we're making them aware of addiction and what's actually going on, that people can get better. There are so many people out there that think that their son or daughter is an addict and they're going to be an addict for the rest of their lives, which of course isn't true or isn't necessarily true. So we need to take our time. We need to be directed in our actions. We need to make sure that we are investing in people, even if those people have a chronic relapsing disease.
Dr. Day, thank you. Joe, final comments that you might have about recovery coaching and the importance of recovery coaching. Everybody's not familiar with the notion of recovery coaching. So can you just take a couple of minutes and talk about what it is and the value of recovery coaching?
Recovery coaching, talking about the value of it, it's for me it's very enlightening. I really get a lot out of being able to be that in-between person, that liaison in between the addict and maybe perhaps their family, to give their family a little bit more insight on how the process works and what it is that their loved ones is going through. Based on my own experience, I can, connect with the mother, the father, the daughter, whoever it is that's solely concerned about their loved one, and let them know that the process does work. When I was going to Governor State and I was getting all this information about the opioid crisis and things that was going on, in my mind, I still try to keep it as simple as possible. I understand that opioid is, it's a substance, but to me, it's just I want to say, and I just want to speak freely. To me, it's just dope. I come from an era where cocaine and heroin and everything else. I mean, so it's just a substance. It's like any other substance. It needs to be addressed with total abstinence. This is my belief. This is what's been working for me. And as a recovery coach, I try to give the parents or the family, I try to give them the information to let them know that their son needs treatment. They have to start somewhere. It's got to start in a 29 or 28-day program. It must start there. Because I know, according to the science, that there is an antidote for that. They filter those drugs out of their system. And then the therapeutic value of one addict having another has to come in and talk and get them the clarity that they need so they can change their ideals and their attitude about life and living life on its own term. Because from my perspective, most of the addicts that I come in contact with that were constantly using was trying to escape the reality of life. They do not want to live life on its own term, whether it's poverty, lack of finances, bad relationships. Those are life on life stuff. Those things are going to happen. But if you put the dope or you put the opioids or you put the heroin in between the reality of life and the individual, he'll try to escape by using it. And the end result is going to be dramatic. It's always going to be jails, institutions, and death. Always. And
Joe,
not necessarily in that order.
Very much, Joe. Dr. Day and then Dr. Fataki, kind of a final comment from each of you as we wrap up. Final comment to leave one another and those who have joined us with.
So in terms of Governor State and universities in general and addiction, I think the universities are doing a stellar job in making their students and the communities aware that recovery is possible. To me, that's the most that an institution can do. And I see Governor State in its addictions studies programs, but in general, its connections with the community help people cope with addiction, poverty, COVID. So Governor State, in my opinion, is a community-based institution that's doing an outstanding job in this area.
Dr. Day, thank you. And Dr. Fataki, final comment?
Well, what I would like to leave us with is that we need to look at addiction as a chronic illness, and that one size when it comes to treatment does not fit all. We just have to figure out what's going to work for each individual. And the best thing we can do is to continue to be advocates for our patients. Looking at the panel today, there's no way anyone can look at us and tell who may have had a problem with addiction, who has diabetes, who has asthma. It's not written over anyone's face. It's just the labels that we as individuals or as communities have decided to put on a certain segment of the population and use that to continue to stigmatize and oppress them. But I think one of the best things that we can do is to keep speaking up, just like we've done tonight. I'm proud to be in the field that I'm in. I'm proud of the people that I treat and the people that have mentored me and the people that I interact with. And I just hope that we'll continue to work together until we can bring treatment and recovery to everyone who needs it.
All of you, thank you. I have always been very fond of saying that all of us are better than any one of us. And I believe that to my core, and I believe that's how we help those who are suffering with addiction. I hope that tonight we brought some hope, that we brought some ideas for help, and we brought some optimism and some awareness and helped you to think about recovery. If you have a family member, there is hope, and there are things that you can do to help that family member or family members get help and move to the next best place in their life. Thank you very, very much for being with us tonight.